Give us some. So the name of the company is what in terms of the cannabis?
Okay, so the GP, that was the parent company is Game Face. Game Face is passed down. Yeah, Game Face is passed down to me. So I'm still everything. I've been running Game Face for almost 2 years now. So once I got the GP, I'm in growing farms. GROWINGPHARMS, keeping the same name acronym. And just something that's more corporately appealing
Northam
in order to
live
get
streaming.
us in more doorways. And when we made that
Let's check
transition,
it out.
Face,
we made
the
that
social
transition. We actually
distancing,
opened up
which
a lot
I've
of
already mentioned,
doorways, and we also
and covering your
literature. So
face
the
if you
main
sneeze
brand
or
that we
cough.
push
My
for
records.
corporate dealings is
But we
growing
said
farms, but the
we're
membership
watching
company that allow people to come
Virginians,
in,
and I'm
you know,
proud of
smoke
what most
cannabis,
Virginians are doing.
whenever they see fit,
But
grow in whatever state.
let's be clear,
That's attached to the game
there are a
and the
few
brand.
people that are not yet getting the
Okay,
message.
when you say do whatever they see
If our
fit,
restaurants,
that's
our
primarily
fitness centers,
research
our
and
theaters
development
stay
based,
open
right?
with more
Yes,
than
it
10
is.
people,
It's primarily research
with
and
more than
development.
10
I don't want y'all to
patrons,
think that
you can be
you're
charged
signing up for a
with a
membership to pull
misdemeanor
blood. That's
and
not
lose your
what it
operating
is.
permit on the spot.
But now, that is a
This is
part of the
real.
definition.
I am taking this seriously, and I ask you to take it seriously as well. We will get through this, but it is imperative that everyone does their part to limit social interactions and slow the spread of this virus. Again, thank you all for listening this morning. I'll be glad to take questions.
Hold on,
The
brother
CBD
Inky.
oils, that's
Yes.
Are there plans to do anything other than just ordering more equipment?
It's a great question. Dr. Carey is prepared to answer that question.
Thank you, Governor. The question is about PPE availability in the Commonwealth.
Okay, just had to share that, of course, you know.
And what we're doing about it. I think first and foremost, we're distributing what we get from the national stockpile. I think also whether it's a private practice doctor's or provider's office or our health systems, they are also using all of their supply chains to make sure we have as much PPE as our providers need. Critically important. Second, at the Virginia Emergency Support Team, the VEST Logistics, they are looking at following every lead. We're getting lots of leads from folks, whether it's General Assembly members or folks in industry or in healthcare that have some leads on where we might get additional supply. And we are following those down to make sure that those is that a real possibility? What's the lag time? And what resources it will take to get those online. We are also looking, we've had industrial suppliers, for example, of personal protective equipment around mining and quarry work that have the same N95, N99 masks. They may look a little different, but they're perfectly serviceable in a healthcare environment. So we've had those suppliers contacting us, and we've been working on that procurement. And we've even had some manufacturers in Virginia who may be able to make N95 and N99 masks very quickly. So we are not, that has not come online, and we are pursuing every opportunity. And I think it's also important to say that this is a national problem. This will not be solved without a national solution. Otherwise, you have each state grabbing for what they can, and we are in a responsible way. But we need a national solution. We've heard about the War Powers Act, but we need manufacturing collection and manufacturing and in meeting those supply chains so that the frontline medical first responders, folks in prisons, et cetera, that are in contact with patients with COVID-19 or those that might have it, have the protection they need. So this is a national emergency within a national emergency.
Governor, are you considering a workforce limitation order like that of other states?
You know, this is a very fluid, the question is, are we considering a workforce limitation? This is a fluid situation. It's dynamic. It literally, as you all see, changes hour to hour. I assess what is happening, not only in Virginia, but in this country, hour by hour, and make decisions accordingly. As we've already mentioned, I have input from a lot of different people, well-intended people, and I appreciate their input. But we have taken aggressive steps in Virginia to combat this, to keep it under control, to flatten that curve, if you will. And I'll continue to monitor it and make decisions as necessary to keep Virginians safe.
What might it take to implement such a workforce
Again,
limitation?
I'm not here to answer what ifs. I'm telling you where we are today and what we're doing to keep Virginians safe. Your question, Laura, is if they need increased capacity, what means are they taking to?
Well, you had mentioned that you signed this order last.
Yes, absolutely.
That you have specific hospitals that have said that we need more, we need X number more beds in this location or attempt.
Great. You know, it's all about preparation, and Dan, if you want to just elaborate on that, thank you.
Thank you, Governor. The question is about, one, the COPN waiver was, the governor mentioned in his remarks, and what have we heard from the health systems about what they're doing? And first of all, that is coordinated through the VEST, and there is the Virginia Hospital and Healthcare Association there with the VEST members looking at how to distribute PPE, for example, and also looking at what opportunities they have. There is the kind of three levels. There's the first level is what they can do on their current footprint, and talking to hospital senior leadership around the Commonwealth yesterday, they very much have their plans in place and how they will get from A to B and what will need to happen for staffing. Second is, are there adjacent areas on health systems and communities' footprint? And then there's really national-based things where we're already looking and planning with the National Guard, planning, not mobilizing, along with FEMA, getting those initial plans of what alternative sites for medical care would look like and what those requirements. So that planning is happening and very, very robust.
Yes, Kate. I've been getting some calls from doctors saying that in terms of testing supplies, in some areas they're running so low that hospitals aren't even performing home tests. Is the state aware of anything like that, or is there any validity to that? I can't validate that information. The state doesn't have that.
The question was whether areas around the Commonwealth are foregoing testing or are not doing influenza testing. I have heard that transport media are in short supply, and I'm looking over to Dr. so that the swabs are in short supply in particular. And I'm asking a question, Dr. Tony, the swab that can be used, there are swabs that can be used for either? Yes, so they're viral transport media. So that would be a rationale for not doing one versus the other, but I have not heard specifically that those are being traded off. Dr. Tony, any additional comments? No. Thank you, Governor.
Yeah, I was gonna say, do you guys know or have a specific number how many tests are still available in Virginia? And if you guys do know, are you guys comfortable with that number?
Yes.
Good morning. I'm Dr. Denise Toney, the Director of the Department of General Services Division of Consolidated Laboratory Services. So your question was, did we have a number of tests that are available in Virginia? And what I can answer is with respect to the capacity at the state lab, we have the ability to perform testing for over 1,000 patients. We are continuing to receive additional supplies that increase our capacity, and we have also changed the number of specimens that we are testing per patient, which also has supported our ability to maintain more tests per patient. There are also hospitals and private laboratories within Virginia or supporting Virginia that have testing capacity that also increases our number and the availability of tests for the citizens of the Commonwealth if they meet the criteria.
So you got who? Ralph Northam doing business as the governor of Virginia. They giving a briefing.
No, they haven't.
Giving their briefing about coronavirus.
Yesterday, you know, as we're continuing to see cases go up as more testing is done, I'm wondering again, you know, whether we could extend the emergency order to apply to more types of businesses to make it enforceable, you know, to actually force attendance.
They can only affect businesses and fictitious entities. They can tell your business to close because
Again, you know, this is a dynamic situation, and we monitor that literally minute to minute, hour to hour. What I would say in response, I think of most importance is it's all of our responsibilities. It's really in the people's hands of Virginia, and we, you know, we will do what we need to do to enforce. But I would encourage Virginians that if you don't abide by our guidelines, you're not only putting yourself at risk, but you're putting others at risk. And that's something that we should all take into consideration. And when I say others, our family members, our parents, our grandparents, and perhaps most importantly, our healthcare providers and our first responders. And as I articulated earlier in my comments, we all collectively need to do everything that we can to keep those individuals healthy because they are literally our first line of defense. So I encourage all Virginians to abide by our guidelines.
For the company,
This question is a follow-up to
the corporation called Virginia.
requirements for first responders, for primary care physicians as well, and those in nursing homes. Where specifically throughout the state is this of need immediately? How soon will these?
It's a crown virus. This is the crown falling down. Because the Virginia company.
Thanks. So the question
was
is
chartered
about
by the Crown.
the revised testing criteria, specifically healthcare workers and nursing, and the nursing home criteria, and where geographically that is of most need.
Yes.
I'd say, the first thing I'd say is that the testing criteria apply Commonwealth-wide. So where those outbreaks are occurring, where the nursing home situations occur, obviously that's where it would be directed to first. And that situation definitely evolves on a daily basis.
And correspond with them privately and notify them of your private.
Wherever
status.
they may pop
You are
up, but
living
yes, those are the
souls.
ones we're aware of right now.
Thank you so much.
Just in closing, again, thank you all for being here. Again, please take into consideration to take care of yourselves out there across Virginia. We're all in this together. Check on your neighbors. Check on individuals, especially elderly, those that have medical conditions, to make sure that they're okay. I tell people all the time as I travel around the Commonwealth that it takes a village, and we're all part of that village, and I thank you all for continuing to work with us and helping all Virginians. So we will see you again tomorrow at 11. Thank you very much.
And you've been listening to an update on the coronavirus from Virginia Governor Ralph Northam. I do want to mention a few bullet points that they spoke about there. As of today, there are 152 coronavirus cases in the Commonwealth. Now, we also heard from state officials, and they were talking about refined testing criteria, how they are prioritizing medical professionals who have developed symptoms where outbreaks have occurred. They also talked about getting masks and gowns in the Commonwealth and distributing them as soon as they can when they get them. Now, we also heard Governor Ralph Northam talk about being wary of rumors. He says he has activated the National Guard, but he says he has not mobilized them yet. He says they are ready when needed. Now, we'll continue our coverage of coronavirus concerns on Wavy News 10 at 6 and all the time on wavy.com. I'm Deanna Betaneshi. This has been a Wavy News 10 special report.
the National Guard? Who does the National Guard protect? Who does the National Guard protect? Couple of points. You know what I mean? Again, remember, these are people doing business as. So this is Ralph Northam doing business as the governor of Virginia. Right? All this is within the framework, you know what I mean, of their business incorporation. Their business incorporation has a constitution, you know what I mean, it has employees and all that. It has stock, you know what I mean, all those things. But what's happening here, you know what I mean, supply chains are falling, you know what I mean, it's more economic than, you know what I mean, illness. Hence, a coronavirus, a crown virus, it's all code word, code talk. You know what I mean? By saying that the virus resembles a crown. And the virus does resemble a crown because the crown has been a virus on the planet. Right? But those are just my opinions, my open eyes on it. Me, 7K, living soul. Hey, you, Raul. Hey, living. But yeah, I just wanted to get that on live and on my own records for my own posterity, so the words will be immortalized in the records. What you said in the briefing, that was probably definitely written, scripted from a teleprompter, except for answering questions or whatever. But they'll forever be immortalized in these records. 7K. Keep it out. Peace.